One is, what are the basic symptoms wherein people can possibly realize that they have or they are borderline diabetic?
So from that, Bhavya, a person with diabetes is called as Bhavya Desai with diabetes and not a diabetic. This is a nomenclature change because you don't want to label somebody as, a diabetic. So a person with diabetes or a people with diabetes, one, there are no symptoms. Only 25 to 30% will have symptoms, and that also at very high blood sugar levels. So it's mandatory that you start checking at least by the age of 30. If not, if you have a strong family history, much younger than that. But at least by the age of 30, an annual checkup on your sugar, lipid, kidney profile, liver profile, extremely important. Because by the time majority get diagnosed, especially in other parts of India, they've already developed some complications. And today, the treatment is very different. Like a decade and a half back, we were very sugar centric. We would just chase the sugar. But today we have got drugs which are based on patient's risk profile. So suppose the patient is overweight, then the drug profile is different. Suppose the patient has a kidney disease, then the drug is different. Suppose the patient has heart disease, then the drug is different. Suppose the patient has heart failure, the drug is different. A patient has liver disease, the drug is different. So it's not that one size fits all. So it is tailored based on the person's complication or the person's risk factor. And today when we treat diabetes, we do a risk factor review. We see how many risks are you having. So you're a diabetic, you have blood pressure, you have cholesterol, you're a smoker, you're eating out, you're obese, then he becomes a very high risk for me. And if he has a strong family history of any of the problem, then he becomes a very, very high family, very high. So he needs to be given a lot more preventive checks as compared to a garden variety of patient who doesn't have any other things. He's very mildly diabetic, doesn't carry any other risk factors and stuff. So there needs to be categorization, risk categorization of people with diabetes. And that is the best way to treat this. So you cannot just look at the sugar as the problem. The sugar is the problem because of which you get diagnosed. But the treatment is based on multiple other factors surrounding it.